It is important to monitor blood pressure as this can help with the early diagnosis of many conditions, help to track any treatments and encourage better control of your lifestyle. Hi Taylor, my name's Danielle and I'm here to take your blood pressure. Have you rested for 15 minutes?
Yeah.
I'm just going to ask for your consent now.
Yeah.
Do you mind if I take your blood pressure?
No.
Is there anything that may affect the readings, such as
No.
caffeine intake or medications? What I'm going to do, I'm going to take your blood pressure on both arms using this monitor. It's a digital monitor. And then I'm going to do probably 2 or 3 times on each arm to make sure I get an accurate reading. Would it be okay if I have access to your upper arms?
Yes.
I'm just going to check that the cuff fits because we don't want it too tight or too loose. And I'm just going to start the machine now. So if you just like to relax and sit still, I'll press start. The cuff will begin to tighten and this should take less than a minute. Okay? Okay, I'm just going to do your other arm now. Would it be okay if I have access to your left arm? And again, I'll do the same process. And I'm going to check the cuff. And I'm going to check that the lead is facing downwards. I can just put your hand there. And again, if you'd like to sit still, I'm just going to press start. Okay, I'm just going to make a note of your readings and then after that we will proceed to do both arms again 2 or 3 times for accuracy. Okay?
Yeah.
Thank you. It is important to understand blood pressure readings. When blood pressure readings have numbers of less than 120/80, 120 systolic and 80 diastolic, these are generally considered to be of normal range. When blood pressure is consistently displaying a systolic 120 to 129 reading, this is considered to be elevated. This can mean there is a higher chance of developing high blood pressure. However, in most cases of readings within this range, there are lifestyle changes which can control this, such as regular exercise, losing weight or reducing alcohol consumption. Hypertension is classed as either stage 1 or stage 2. Stage 1 hypertension will have readings of 130 to 139 systolic or 80 to 89 diastolic. For stage 1 hypertension, a doctor will suggest lifestyle changes and possibly prescribe medication based on risk factors, for instance those from a heart attack or stroke. Stage 2 hypertension will have blood pressure consistently reading at 140/90 or higher. Treatment will include a combination of medication and lifestyle changes. Hypertension crisis with readings of higher than 180/120 will likely require urgent medical attention. It can be normal for systolic blood pressure to rise above 180 during exercise for some people. However, it is always advisable that a GP is consulted to exercise safely.